think one of the common sort of myths about depression is that it always presents as someone being very sad and crying, but it really is a host of different symptoms. Some of the things that really can be triggering for people in terms of depression in later life can be things like the development of chronic health problems, and especially chronic pain. It can be very difficult when you have chronic pain, and that can affect people's mood. Other things that occur later in life that can trigger depression are sort of loss of loved ones. Social isolation and loneliness is really an important issue that is linked to clinical depression, and a lot of older adults may experience a kind of withdrawal, a social withdrawal, and a feeling that really things don't give them joy anymore.
Someone who normally was going to church on a regular basis may stop doing that. So it's really isolating oneself away from family and friends that can be a sign of depression for older adults.
For older men, sometimes too, what they really are most aware of, and sometimes their spouses as well, is that they're more irritable or angry. Sometimes that anger or irritability can be a sign of depression. Of course, one thing that we really are concerned about in older adults is having thoughts of not wanting to live, suicidal thoughts. Sometimes people can experience feelings of worthlessness or hopelessness. Part of their depression really seems to be driven by misperceptions about themselves or about the social world. The other really important point is that clinical depression is not something that occurs during a part of one day or just for a couple of days. And for some older adults, depression for them, living in a state of depression, can kind of become the norm. So it almost feels normal to them. And so they need family members or friends or their clinician to really point it out and to help motivate them to get treatment.